Okay, my name is Larissa and I'm going to be doing a newborn assessment. So first I would perform hand hygiene and then I would apply gloves. What I would start by doing is doing vital signs. So I'm going to go ahead and grab my stethoscope, and it's already been cleaned. Okay, and I'm going to start by listening to the heart apical pulse for a full minute. And I'm noting the respirations. So the pulse should be between 120 and 160, and the respiration should be between 30 and 60. Okay, and then I'm going to take the temperature, axillary or in the anus, but this will be less damaging. Okay, and then I'm going to go ahead and assess for pain. I'm just going to be taking note of the cry and any grimacing or movements that could indicate pain. Okay, moving on, we're going to go ahead and get a weight on the baby. So I'm going to move him to the scale. We're going to get the weight in pounds and ounces, and then of course in kilograms. Moving over, we're going to go ahead and get the length. So let me get my measuring tape. And then we get from the tip of the head, extend the leg out to the heel. Okay, we're going to measure in inches and in centimeters. And while I'm measuring, I'm going to go ahead and do the head circumference as well. Just right above the brow. Okay, there's the head circumference. Then we're going to do the circumference of the chest, right over the breast buds. And then the circumference of the abdomen, right above the umbilicus. Okay, now our measurements are done. Moving on, we're going to go ahead and look at the skin. So while we're looking at the skin, what we want to see is that the color is appropriate for ethnicity. We want to note the texture should be smooth. And then we're going to assess for turgor, but we're going to do this very carefully since the babies have very thin skin. Okay, and then we're going to flip the baby and look for lanugo, which is just the excess hair above on the upper back and on the arms, still present from birth. And then while we have the baby flipped, we're going to go ahead and look for any rashes on the front or the back. Look for Mongolian spot, and we see nothing here. And then we're just going to note that the baby is covered in vernix, which is that good coating, and we're not going to remove it because it's healthy for the baby. Okay, moving on, we're going to go ahead and do reflexes. So we're going to start with the blink and the pupillary reflex, which I can assess with my pen light. So whenever I shine the light, the baby should blink, and the pupils should constrict just very little, and we should be equal and reactive to light. Moving on, we're going to do the startle reflex. So we're going to hold the baby. We're going to do a slight drop, and the baby's arms and legs should flail out. Moving on, we're going to do rooting, which is going to start right next to the mouth, along the cheek, and the baby should turn that way with the mouth open. And we're going to do this to both sides. So along the cheek, the baby should turn out with the mouth open. And while the mouth is open, we're going to go ahead and insert our finger and check the sucking reflex. And while our finger's in there, we're going to assess the hard palate and the soft palate, and look at the tongue to make sure that it's freely movable. Okay, moving on, we're going to go ahead and do the palmar grasp. So my fingers inside the palms, they should grip. And then the plantar grasp, the same thing with the feet. The toes should curl around. And then we're going to go ahead and pick the baby up and assess the stepping reflex. So the baby should pick a few steps. Then we're going to look at the Babinski. So we're going to do the upside down J on the feet. The toes should flail out. And the same thing on this foot. And the toes should fan. Now we're going to do the tonic neck, also known as the fencing. So I'm going to turn the baby's head this way, and the arm and the leg should follow that same direction. And then we're going to do it to the other side, and the arm and the leg should follow. And then we're going to go ahead and assess a prone crawl. So I'm going to place the baby prone, and the baby should attempt to scoot up and do a crawl. And before we finish, we're going to do the trunk incurvation. So I'm going to hold the baby like this and run my finger along the side, and the baby should tilt one way. And then we're going to do the same thing to this side, and the baby will curve this way. Okay, moving on to the head, we're going to look at the general appearance. We're going to measure the size, which we already did, and we're going to looking at the molding, making sure there's no bulging around the edge. Then we're going to assess the anterior and posterior fontanelles. They should be flat. We're going to ensure that there are no cephalohematomas which would be bruising and pooling of blood on the top of the head or around the head. And making sure there is no caput succedaneum, which would be the cone head appearance. Okay, moving on to the face. We're going to look at the general appearance, making sure it's symmetrical. We're going to look for any markings on the face that would indicate a forceps delivery or a vacuum delivery. And there would be markings on the face, here or here. And then we're going to look for milia, which are the little sebaceous glands right along the nose, which are perfectly healthy. We don't have to do anything about that. Moving on to the mouth, we already assessed for the tongue, and we assessed the hard palate and soft palate. And we just want to ensure that their facial nerves are working perfectly. Okay, now onto the ears. So what we're going to do is make sure the external ear is in line with the eye. So we're going to start right here, draw a line here, and draw a line. And what we're doing there is to indicate that they're in line, making sure they're not low-lying or deformed, which could indicate a genetic deformity or a defect. And then we're going to check the hearing as well. And so the baby should just be able to recognize mom's voice and turn that way whenever mom speaks. Okay, moving on, we look at the eyes. And there are a couple of things we want to note when we move to the eyes. We're going to look at the general appearance, making sure they're both symmetrical. We're going to make sure that they're able to coordinate. We're noting the color, which is blue, making sure the eyelids are intact. We're going to inspect on the inside, so we're going to look at the cornea. The sclera should be white. The pupils should be there. We're going to look at the conjunctiva, which should be slightly pink. And then we're going to assess their vision. So the baby should just be able to see from here to mom. It's still a little bit blurry and swollen, so we just have to ensure that the lashes and the lacrimal glands are there as well. Moving on to the nose, we're going to go ahead and assess for patency in both nares. So what we'll do is cover one and feel air in the other one, and then we'll do the opposite. Cover one and feel for the air on the nares. Then if we're having a little difficulty doing that, we can go ahead and close the baby's mouth by tilting the chin up and assess for air coming out. Okay, moving on to the neck, we're going to go ahead and look at the general appearance of the neck. And we want to check at the back and look for extranuchal folds, which would indicate a defect. And then we're just making sure that it's freely movable. As we move on from the neck, we're going to go down to the chest. We already measured the circumference, so now we're just going to look at the general appearance. We're going to watch the expansion and making sure there's no retraction inside, which would be like accessory muscle use. And then we've already auscultated and the lungs were clear, but it is normal to hear a little bit of fluid since they're just born. Okay, and then we're going to look at the breasts, and if it were a preterm baby, it would be flat, but a term baby would have a slight elevation in the breast buds, which could also be measured in millimeters, which I could do right now. Measure there. Okay, and we already auscultated the heart. S1 and S2 are present. There was no murmur, but it is normal to hear a murmur at the beginning. And we just want to go ahead and let the healthcare provider know. We've already measured the abdomen, the circumference of the abdomen. So now we're just going to look at the appearance, making sure that everything looks okay. And we're noting that the umbilicus is midline, making sure that it's clamped off, and we're going to note whether it's still dry, if it's still wet, or if it's drying out. And then we're going to go and feel femoral pulses and just assess for any inguinal hernias. Okay, now we're on to the extremities and the trunk. So we're going to look at the arms, legs, and where they should be is flexed. So we're going to look at the hands and the feet. We have 5 fingers, 5 fingers, 5 toes, 5 toes. So everything looks good there. Then we're going to assess the spine curvature, which if you hold the baby like this, it should be a slight C shape. Okay. And then we're going to go ahead and assess the hips for any dislocation. So what we're going to do is make sure to apply support here to the hips and grab the legs. And we're going to go up, we're going to go out, and then we're going to go back down. And when we do that, if we feel any popping or hear any popping, that could indicate a dislocation. Okay, now back to the general appearance. We want to make sure that if there is any yellowing, we note that as jaundice. And there's 2 different kinds. There's physiologic and pathologic. So physiologic is just the normal expected light yellow. Pathologic would indicate that there's a disease process underlying. And so we want to note that jaundice occurs from head to toe and that it relieves from bottom to top. So if we see a baby that's completely yellow, we want to know that we're going to get help right away. Okay, and then moving on, we're going to assess the bowel movements. So the first bowel movement should be meconium, which is like a tarry-like substance. And then we're going to note to the parents that if they are breastfeeding, that the stool is going to be very runny or watery, and if they're formula fed, it will be a little bit more consistent and have a slight odor. Okay, and then onto urine. We're going to go ahead and note that the baby should void once for the first day, 2 for the second day, and so on and so forth. And for the first week, at about the 7th day, we'll develop a routine between 6 to 10 times a day. Okay, and then looking at the genitalia of the baby, so this is the female, I'm going to be looking for the mons, the clitoris, and the vagina. If I had a male, I would be looking for the penis, the scrotum, and the testes. And I would ensure that the urethra is on the top, and I would ensure that the testes are palpable. They should feel almond-like, and they should be dropped. Okay, before I conclude, looking at the buttocks and the anus, we're looking for symmetry right here. And then we're making sure that the anus is paid, which could be indicated with the bowel movement. And then lastly, we want to make sure that the cry is very strong, moderate toned, and will be controlled after consoling for 3 to 7 minutes. And I'm done.